Good morning, my name is Karolina Popławska-Domaszewicz. I work in Poznań University Hospital, and I'm also affiliated with King's College Hospital in London, and I'm movement disorder specialist.
Hi there, Ray Chaudhuri. I'm a professor of movement disorders and director of the King's Parkinson Centre at King's College Hospital and King's College in London. So I think there's a lot of initiatives now which is looking at Parkinson as a heterogeneous condition, not just a single disorder. In fact, we published this in 2017, that Parkinson is a syndrome and not a single disease. And now it's good to see that several people have taken it up. Movement Disorder Society has got a group which is looking at staging and definition of Parkinson's. More recently, Eoin Mulroy and others have followed our recommendation and tried to describe Parkinson as a various syndrome, Syndrome 1 and Syndrome 2 they call it. So it's basically based on the fact that there are multiple neurotransmitters are involved, not just dopamine, acetylcholine, serotonin, noradrenaline. We're published on the cholinergic deficiency, noradrenergic dysfunction, and these presents in various different ways. And I think the important thing in clinical practice is for us to recognize this, the different ways these Parkinson patients present in different subtypes, particularly the non-motor subtypes, because that drives then very individual subtype-based personalized medicine. And so one size doesn't fit all. So you'll have how you treat a cholinergic subtype of Parkinson is very different to a sleep-dominant Parkinson, where you probably will not be prescribing drugs such as pramipexole or ropinirole because of sleep events. And it's quite different to how you will avoid anticholinergic drugs in cholinergic subtype. And it's quite different to how you treat a noradrenergic subtype, where your focus is on the autonomic function, on pain, on REM behavior disorder, etc. So I think that's how the concept has changed, and our personalized medicine delivery is now highly based on those concepts.
Stepped Care Toolkit is a modern holistic pathway of care for all healthcare professionals who look after people with Parkinson. Stepped Care Toolkit includes motor assessment as well as non-motor, with focus on cognitive and neuropsychiatric function, sleep, autonomic dysfunction. It also ensures that bone health, gut and oral health, comorbidities, comedications are not overlooked, and generally it gives very holistic management for Parkinson disease. And now the project has gone global. We have center from Japan, China, India, Malaysia, South Africa, Egypt, Tunisia, and many Chile, and many European ones. And I'm very delighted to coordinate this project with Professor Chaudhuri and his wonderful team, especially with Dr. Kumar, Dr. Trivedi, Dr. Batsu, in King's College Centre of Excellence in London.
The dashboard incorporates the 5 vitals of Parkinson, which actually Karolina mentioned in her stepped care, because the stepped care is in a way practical implementation of the dashboard, if you will. So the dashboard has motor as a vital, non-motor as a vital, gut, bone and oral health as another vital, then vision, and finally comedications and comorbidities. So this is being implemented as part of the stepped care. We are very much hoping that this will be a prompt that is either available as a printout or perhaps in the future as a downloadable app version for all doctors and healthcare professionals. We'll download this before they do a clinic and make sure they check these things in every patient and not forget things such as bone health or checking for anticholinergic drugs, etc. So I think it's being widely implemented, and I'm hopeful that once Karolina's stepped care program is completed globally in those centers, then we'll be able to put it in the framework of the policymakers, so it becomes pathway of care for Parkinson's all across the world. I think the timeline-wise, we're probably looking at the initial, what we're currently doing is doing a cognitive pre-testing of the stepped care paradigm. So we've asked a group of doctors, healthcare professionals and patients to give their opinion on the toolkit. We are hoping to complete that by end of April. Then we'll publish that data. and based on the recommendation, the final form of stepped care paradigm is available. So we're very hopeful that the final protocol or the pathway will go out towards probably September, October time, perhaps in time for the Movement Disorders Congress.